Hello, my name is Tracy Lee, and today I am going to be talking about asthma and what it can be like to have asthma. I decided to pick this topic to talk about because this is something that I have dealt with my entire life. Asthma can be a real pain, especially for some people, because some people get lucky and grow out of it, but some people never grow out of it and is unlucky. Sadly, I am one of them people that have never grown out of it. But that's okay, because I know that everything happens for a reason. And everyone just needs some hope, and it's okay. People with asthma can be affected by the weather. I say this because when the weather starts to change, it can mess with people's breathing. For me, it's when it starts to get cold outside, and actually for me, it's almost every time it changes the weather. Asthma, it can be minor or it can interfere with daily activities. I will get to that in a few seconds. Just be patient with me here. I am so sorry about not keeping eye contact. My memory is really bad also, so in some cases, it may lead to a life-threatening attack. Asthma is a chronic disease that affects airways and lungs. During asthma attacks, patients can experience wheezing, coughing, shortness of breath, tightness, and pain in the chest, along with so much more. Asthma can usually be managed with rescue inhalers to treat symptoms and control inhalers that prevent symptoms. Severe cases may require longer-acting inhalers that keep the airways open, as well or steroids. Asthma attacks can be triggered by allergens, exercise, smoke, pollution, airway infections, and a lot more, including vaping or even fire smoke. Anything can cause it. And when you get too hot, it just depends on many things. Because it doesn't always affect one person the same as it would affect all the other ways. If someone with asthma starts having an asthma attack, you should sit the person upright comfortably in loose, tight clothing. I wouldn't say give them in a hoodie or a long sleeve shirt, because that can make them really hot. Say maybe like a loose tank top and a loose pair of shorts. That's what I would say. But everyone's different, so I can't exactly say that. If the person has asthma medication, such as an inhaler, assist in using it. If the person doesn't have an inhaler, use from a first aid kit if there is one. In my opinion, I would not try to borrow someone else's inhaler because the medication they have may be different from yours. And honestly, that can make the attack worse. But there's a chance that it may help, but I wouldn't take the chance if I was you. It's just how I see it. But, hey, it is what it is. So here's what I'm gonna do. I'm gonna tell you a story about when I went into a severe asthma attack. It started when I was working on my schoolwork. I was sitting in this exact spot, too. And honestly, I'm not exactly sure what happened after. I remember walking in there to my family and telling them, like, hey, I'm pretty sure I'm going into an asthma attack here. So, it was kind of a whole rush thing. It got so much worse. I felt like I couldn't breathe. I was getting extremely hot. The worst thing, I was also getting a little dizzy, so I had to sit down and be careful. But at the same time, I ended up starting to scream. The reason why is because my head was starting to hurt so bad. My mom ended up calling the ambulance. They got here in about 10-15 minutes. Some might have been longer. When I got to the hospital, they told me that my head was hurting so bad because from where I couldn't breathe, I was trying to get air from my brain or something like that. I can't exactly remember what they said. But after about 2 hours at the hospital, I was finally able to leave from there, especially after one of the doctors came in and told me that they wanted to keep me for a while. But I told them that I had school to do, I didn't have my computer or anything, but in the end, I am extremely better, as y'all can see in the flesh. Thank you for listening, and have a good day. Be safe. Bye.